patient comes to me with what is a grade 4 capsular contracture on the left side from her set of implants from 2011, just 14 years old. So a lot of pain, low BMI, just one set below the muscle. So as you will see, this is the right side. I cut out the excess skin for contouring. You will see some areas relatively thin, and this is more kind of round. You can still see that bump edge, you know. So this is on the right side, but on the left you will see this is kind of bunched up and higher, and it is less round, meaning it's more elevated, it's contracted. So on the on the right side, as you will see with my sterile gloves, 100% total capsulectomy, 10, 28, 25 initials JS. And as I go in, you can see the capsule is reasonably reasonably thin and very interesting. So as I go in, so the first thing I want to show here is, if I go in, look at this. This is a rupture, right? Clearly. And this is not what I would call an intact implant. And lo and behold, the way to tell is look at the color of it. And if I go like this, look at this. And this is what is a ruptured implant. Mentor, total surprise, 350 cc's. And again, you will see right here. And so you will see a capsular tissue completely 100% removed, and it's entirely definitively with the inflamed tissue. It has been kind of working as a barrier, if you will, meaning as a filter, stopping in this. So some areas relatively thin, some areas thick, and overall I'm very happy and content with how the whole dissection has gone. Complete total capsulectomy. Total surprise that this right one ruptured, and the right one was an involved part. Left one, as you will see, grade 4 capsular contracture. Grade 4 capsular. This is the Baker's classification, full thickness skin. You will see this incision right here. This is the lateral, medial, superior, inferior. This is the incision. So this is where her crease was. And overall, as you will see, it's very much rounded. And you will see the rib. Now this is a very tricky case because of the way how her low BMI is and how the implant was sitting on the chest. And the goal here is to remove only the bad tissue, the inflamed tissue. So I was talking to the nice plastic surgeon yesterday from the Netherlands, and you know, it's not only about the capsule, but this inflamed tissue. So if you look at this tissue, it's angry, it's irritated, it's inflamed. I just saw a path report on a patient that I did last week, and she had fat necrosis on the pathology report, and this goes to showing you that that capsule must be indeed very much removed. So as I go in, let's see if it is ruptured or not. Put that here. Remember, it's super tight. It's literally encasing, so I'm going to go ahead and enter it in a nice location. We're going to enter soon. Remember, end block, the gold standard. If it's ruptured, fluid inside, whatever it may be, it has to be removed, because we don't want to second guess the process and say we wish we had removed more. Do it right, do it once, do it definitively. Yes, it is involved surgery, but it has to be done in the manner that it needs to be. Guess what? These are supposed to be the nicer, better, safer gummy bear implants. And this one is ruptured, and more bad ruptured than the other one, because this one was getting there. This is supposed to be the nicer, better, safer, cohesive implant, and look at that. It's like honey pouring out. You can see the calcifications right here. Everything contained, none of this spilled into the chest. Look at these. What we saw were suggestive of maggot eggs, but they're just basically, this is going to be sent to pathology, and we'll see what these reactionary tissue is. And remember, end block, the gold standard. You never know what you're going to find on the inside. You have to always assume that the implants are ruptured, because you don't want to find out otherwise. So look at this, right? And Look how safe this is. I think everyone should get these implants. They're so safe. This is the problem. Unfortunately, you have the same problem that we saw in the 90s where the implants were rupturing, they disintegrate. Look how this one's broken down more. Eventually, this one's going to catch up to that one. And if you can put like a newer one, 5-year-old, you can see that basically the transition. So the implants do basically leak, right? Look at that. And they are not lifetime devices, as we know. She had a grade 4 capsular contracture. Now, one thing, if someone has a grade 4 capsular contracture, does not mean that they always have a rupture. So the take-home message, number one, the surgeon always has to do the end block. That's the gold standard, because you don't want to not do an end block and the next thing you know, this spills into the chest, and that liquid molten honey, if you will, now spills into the chest. No matter how much you wash it out, no matter how many drains you put, 2 drains, it's not going to clear it out. It's slime. Once you get slime on your body in your car, let's say, it's going to be everywhere in 2 seconds, right? Same thing, we don't want it to spill into the chest. So there's a certain etiquette into removing them. One, the surgeon has to always assume that the implant is ruptured to prove otherwise. The 100-100-0 rule, 100% of the time, 100% of the capsule must be removed in what is preferably in the gold standard end block, or 100% full capsulectomy, with 0% of the capsule remaining behind. It's not only the implant but the capsule, but also that inflamed tissue around that needs to go, because it looks bad, feels bad. It might be fat necrosis like the pathology report. The capsules will be sent to pathology to rule out what these irregularities are. So we know it is not, God forbid, cancer. CD30 analysis will be done. We'll do breast cancer exclusion as well, making sure that there is nothing abnormal, so we know the pertinent negatives, pertinent positives. Cultures for aerobic, anaerobic, and fungal. Implants will be returned to the patient. Most important thing out of everything that I have said today, she will get the high definition pictures and videos of the chest wall showing complete removal of the entire capsule from one patient to the next. This is the ultimate goal, the ultimate proof that the surgery was done in the manner that it was. So that when you put this video together along with the chest wall, you will have no second guessing the whole process and complete transparency. So you can only imagine that the patient is going to feel better, especially the grade 4 contracture. She's going to feel healthier. We will see subjectively how she improves. We'll see what the pathology shows. And this is what I say, 20 years from now, I cannot imagine anyone else doing the surgery any differently, any better. She certainly is not a candidate for a lift given her presentation because of her age and because of the implants and because how well she has done right on the OR table as far as recoiling. And overall, I'm very happy and content with how the whole surgery has gone. This is Dr. Khan, Executive Plastic Surgery.